everyone. This is a recording for pediatrics, specifically focusing on developmental milestones as well as a lot of pediatric conditions. This is a great review if you're reviewing for either the ATI, the HESI, or the NCLEX-RN or the NCLEX-LPN. So we're going to go ahead and get started, and we're going to be focusing generally on the main topics that will be covered in PEDS. So it's going to be an overall comprehensive review for you guys. Let's start off with the APGAR scoring system first. So this is done as a newborn right when they're born. This will be done at the 1 minute mark and then at the 5 minute mark. Usually we look at a couple different factors. We have 5 main categories that we're looking at, starting with APGAR. A is going to stand for activity. Activity is going to be usually measuring for the muscle tone. So muscle tone, we're looking to see if they are having no muscle tone, which is not a good thing, or they're having super high muscle tone, which can be considered hypertonicity, or having no muscle tone or very low muscle tone can be considered hypotonic or hypotonicity. Usually, if you're having a lot of muscle tone, what you'll see is that they tend to have more flexed limbs, meaning that they're going to the sort of super tight position when they're super stiff, or their muscle tone is very high. Usually, we want the muscle tone to be active, meaning they're actively moving back between flexion and extension, and at that point, they will receive a score of 2. For your APGAR scoring system, the higher the score, the better it is. Usually when you get some of these things like such as charts where they want you to remember the scores, whether having a high score is good or having a low score is bad, you generally want to remember just the main idea that the higher the score, the better. And it can vary. Sometimes you don't want to score too high because the more that you score, the higher you are on that scoring system. That usually means that your prognosis is usually very bad. But in this case, the higher the score, the better it is. Usually we generally say 7 to 10 is good. So if they're anywhere from 7 points to 10 points, that's usually considered having a child that really doesn't have too many issues or is pretty normal, I would say. So remember, they do this at the 1 minute mark and then the 5 minute mark. When they look at the pulse, remember pulse for your newborns are usually between 110 to 160 beats per minute. Okay, 0 is going to be absent, 1 point is going to be less than 100, and 2 points is going to be greater than 100 beats per minute. Grimace is looking at reflex irritability. This is usually saying that, if you stimulate them, right, that they respond to that stimulation. So if they are at 0 points, usually they're what we consider a very floppy baby. They're not really responding to any sort of stimulation. 1 point is very minimal stimulation, response to stimulation, and then 2 points is going to be prompt. So that could sort of be like, you sort of tap them on their back or hit them on their buttocks and they sort of, start screaming. So that could be kind of considered grimace. Appearance is going to be how they look visually. If they're blue and pale, we would consider that to be cyanotic. That would obviously be 0 points. That usually indicates that there is a lack of oxygenation. And the baby is not receiving enough oxygen at that point. At 1 point, you can see if they receive 1 point, that's usually a pink body and they have blue extremities. This is considered more acrocyanosis. Acrocyanosis in some cases can be normal. It will usually correct itself, but that is something normal to have. So if you see a test question where it says acrocyanosis, that word acrocyanosis, now go ahead and actually put that right over here. No, it's right over here. So acrocyanosis, this is considered normal. So it's just knowing that the body is pink. So the central area of your body is receiving good oxygenation. The extremities are blue. Okay, there's a little bit more of a poor circulation down in that area. And 2 points if they're overall pink. Okay, usually the blue, if they're blue and pale, as in 0 points, that would be considered more central cyanosis, which is concerning. Respirations absent is obviously concerning if they're not breathing. Slow and irregular. That is, again, 1 point. And then if they have a good vigorous cry, usually that means that they have, they're taking in good respiratory breaths. Okay. Usually also you want to consider that the respirations normal for newborns is between 30 to 60 breaths per minute. Okay. So generally, like I said, 7 to 10 points is concerning, is good, not concerning. It's a good number to be in, and usually this is done the 1 minute and the 5 minute mark. Okay, APGAR scores. Really crucial to remember those APGAR scores and what you're looking for. Okay, here we have immunization. So usually with the newborn immunizations that they're going to be receiving are primarily what I call the triad or the trifecta here, which is going to be the hepatitis B vaccination, the vitamin K injection, and an erythromycin ointment. Remember that newborns tend to have more of an immature organ functioning, so it does take some time for the organs to start functioning quickly or at a regular pace. And so usually you will see that they might need a little bit more support mechanism, and that's why we give them that vitamin K to make sure that because the liver itself might not be functioning like it should, it's not really regulated yet. They might need some assistance with helping to clot the blood, okay, to decrease the risk of bleeding. And erythromycin ointment we're also going to give, and this is to prevent any sort of infections that they might have contracted from the mom in the birth canal, to prevent those infections from affecting the newborn, because a lot of the infections that if mom has some sort of infection like an STI or STD, usually what you'll see is that when the newborn gets it, it can sometimes lead to what they call a neonatal blindness. So to prevent things like that, to prevent that any infection from getting into the newborn, we give them that erythromycin ointment as well. Same thing with Hep B. So Hep B vaccinations are going to be given to your infants for that particular reason as well, to sort of prevent any sort of hepatitis B related infections that they might have contracted from mom. And usually this is all given within 24 hours. Okay. And I did put up a immunization slide here. This is per the CDC. This is actually off the CDC website. And this tells you what the immunization cycles usually look like. I don't recommend you sit there and memorize when the first and second dose is, because to be quite honest, you're not going to be tested on that. You will be tested on knowing in general what vaccinations that newborns may be receiving. And usually when those vaccinations are, I would say those months when it's pretty vaccine heavy. So if you look on here, hepatitis B, I would remember because it's given at birth. So it's given within 24 hours after birth. And usually it's a 3-dose series. So you can see that at 2 months, it's pretty vaccine heavy at the 2-month period, because they're receiving everything from rotavirus, Tdap, which is your diphtheria, tetanus, and pertussis vaccine. They're receiving the Haemophilus influenza type B, the pneumococcal vaccine, the polio virus. This is all pretty heavy at 2 months. Okay. And also at the 4-month period, the 2 months, the 4 months, and the 6-month period is pretty vaccine heavy. I do want to make one note here that if you look on here, the COVID vaccine and the influenza shot, they're usually given at the 6-month mark. Okay, and you might have seen this now that we've gone through the pandemic. We are a little bit more aware in terms of, what shots to give it in what month, because you might have possibly gotten questions from parents. Okay, can my child receive the COVID shot? Well, no, not really until they're 6 months or old. And then the influenza, same thing too. So I would just remember those kind of key things that you would probably want to remember. Okay, so pretty much 2 months, 6 months vaccine heavy. Know that Hep B is given within 24 hours of birth. Normal height and weight, no need to focus on specific numbers. These are not specific numbers, they're just average, okay? Average weight is going to be between 5 pounds to 8 pounds, and then average height is going to be 19 to 20 inches. I would even disregard the height. You might get that. You don't need to specifically remember that. It's just there on the slide. It might be mentioned as part of a case study, so your job to say, is it too far away from the value or is it too close? Anyways, NCLEX and ATI too, to a certain extent, will not give you specifics. They will not give you numbers that are very, very close. So just remember general numbers. I would definitely encourage you to remember the weight, though, 5 pounds to 8 pounds, to know that that's the normal weight. Okay, here we have reflexes. So with the reflexes, there are several reflexes, and we typically call these primitive reflexes. The reason why we call them primitive is because these are the basic reflexes that we have. And these are basically the basic reflexes that we have to make sure that we are able to survive, or the newborn is able to survive out in the wild, right? Out in the external environment where they're not in mom's uterus anymore, and they have to be able to get food and survive on their own. So these are several reflexes that you do need to know. Let's start off with, say, the tonic neck reflex for the last part. Let's start off with a simple one. So this is a grasp reflex. So you've often seen, people tell you, oh, you know what, the baby just loved me so much that they grab my hand. So it's not, maybe they do, okay, but it's more of a reflex that you're talking about. So when you put your hand or your finger into the baby's palm, it is an automatic response for them to be able to grab onto that. That is known as the grasp reflex. When this happens, this is usually done as a survivability method for the baby. So if they're place something on the hand, that's for them to be able to hold on, to get a good grip. They're able to hold on to something to be able to survive out in the wild. These are primitive reflexes. If you believe in the theory of evolution, this is sort of where we are basically we evolved from the primates, right? And so the next reflex I want to talk about is the Babinski reflex. So this is a Babinski reflex with the picture of the foot on the right. The Babinski reflex is how you're going to test for it. Basically, is going to stroke the side of the sole of your feet. And when you do that, the baby's feet is going to automatically fan out. It's going to fan out. The toes are going to fan out like that. And that is known as the Babinski reflex. Then we have the step reflex. So this is a reflex that is coming before the walking, before the baby actually starts walking, right? So if you hold the baby in an upright position, they will start taking steps, sort of same way that, we start walking. Okay, that's if you hold them up in that position as well. The crawl reflex is that if you put them into that prone position, okay, it will it causes them to sort of pull their legs under their body and then kick their legs out in a crawling motion. So they're going to be kicking out their legs as if they're crawling. Okay, this is the crawling reflex. And then this is the tonic neck reflex. So the tonic neck reflex is going to be where if you turn the baby's head to one side, the side that they're turned towards is going to go, that arm is going to be extended, such as what you see in the picture. So whichever side that they turn their head to, that arm gets extended, and then the other arm is going to be in a flexed position. That is known as the tonic neck reflex. Okay, and this is also known as ATNR. So you might have seen it referred to as asymmetric tonic neck reflex. And I'll add that right on here, asymmetric tonic neck reflex. There are a lot of reflexes. I mean, there's so many. I'm just going to cover the main one, okay? I did cover a little bit more than I needed to here, honestly. I would remember the tonic neck for sure, the grasp, the Babinski, and the step. I haven't honestly seen too many questions with the crawl reflex, but it's pretty self-explanatory if you see what the crawl reflex means, right? All right, have a little bit more here in terms of the reflexes. Okay, I'm going to show you a picture of motor reflex as well. Remember, motor reflex is what I call almost the almost like an involuntary response. Well, all these are involuntary responses basically, but this is going to be a reflex that if you all of a sudden you're going to hold a baby and you're sort of going to move the emotions of as if you're going to lift them up and then you're going to put them down, not put them down, but hold them down all of a sudden. And so what happens is that the baby gets really startled and then their hands are going to fly out like this, sort of to either grab on or to sort of kind of slow the fall a little bit. That's what the motor reflex is. It is a primitive mechanism that we have, again, to survive. Okay, and this usually happens if there's a sudden loud noise or unexpected movement. It usually happens. Okay. And again, all these reflexes that I'm talking about are normal, okay? If you look on this chart right here, it says age it integrates. What that basically means that these reflexes should be gone by the time they are 2 to 4 months, 3 to 4 months, 3 to 6 months, depending on each of those reflexes, they should be gone. If you see on here, pretty much by about the 6 to 9 month mark, most of these reflexes are gone. Now, the reason why we have these reflexes are to be able to help us survive in our most vulnerable periods, right? When we're sort of dependent on our caregiver to take care of us and things like that. So it's usually gone. It should be integrated. Now, if it doesn't, if it isn't gone, that's usually when we start thinking, there's some neurological deficits in the child. And you'll start to see that in patients, in children, that these reflexes are not usually gone, that they're still persistent. Depends on what reflexes and depends on the severity of the reflex too. If it's, if those reflexes are not going away, it usually indicates neurological damage. If it does go away, or if it's maybe a little bit remaining, that it's very slight, but it's still there, could usually indicate learning difficulties, cognitive difficulties, intellectual issues, all those different things. And then the last one that I want to really focus on here is the rooting reflex as well. This is the one where you have you basically have the child sort of rooting for food, and this is when you touch their mouth. okay, right by the corner, their mouth or their cheek. The baby's going to turn their head and open their mouth towards that side. And that is to sort of help them find food. Okay, so that's one thing too. And then you also have the sucking reflex, which is if you put anything in their mouth, they're going to start sucking on it. That again is a primitive reflex to be able to help them to survive, to kind of help them find the bottle, find the nipple, and be able to kind of feed off of that. Okay, so those are the reflexes that you need to remember. All right, let's get into some developmental milestones, and then we'll kind of talk about what's norm and what's not. A lot of things with developmental milestones, people usually get really confused because there's so many milestones. Like, what age is the baby crawling? What age are they turning? What age are they sitting up? You know, it can be a lot. So usually you want to kind of make it a little concise. I remember when I was in school, I would make up a story. I would say, we have this like we have, you know, I don't know, Mary, who was born at full-term birth, and now she's had this reflexes, and now this is what's happening with her. So you sort of make up a story to help you remember what those milestones are, and how you can sort of move through those milestones at that point as well. So if you look on here, let's start with the very basic, right? So newborn, 2 to 3 months. And usually when I talk about some of these reflexes, not reflexes, these milestones, when they say that by 2 to 3 months, the child should already have this. So it's not that they start having these, they're starting to have these milestones. It's usually at this point, they should have already had the milestone, meaning that they should already have it in place. So at 2 to 3 months, if you look on this, at this picture right here, usually this is at 2 to 3 months, they're usually laying on their back. Okay, they are, and if you put them around, if you even put them into a prone position, so prone, always think with their tummy down, okay? And obviously we never leave a baby in that prone position until we're monitoring them, especially in this 2 to 3 month period, because they're not able to roll over them by themselves. If you put them in a prone position, they will lift their head up. Okay, that's raising head and prone. And supine, remember, it's going to be on the back. So right now, this baby is in the supine position. The way that I remember that, if you guys have trouble, because I remember sometimes I used to have trouble with this, remember holding somebody, like a waiter holding up a plate of soup, okay, or bowl of soup. He's holding his hand up like this, soup, and then prone is going to be face down. Usually at the 2 to 3 month mark, if you can see this baby is turning their head side to side. They usually make sounds with their mouth, and they smile and coo with familiar faces. So they are starting to recognize at this point, I've seen that person somewhere. Oh, that's mom, that's dad. Maybe they don't know that's mom and dad, but they know that that's a familiar person. They're able to smile and coo with familiar faces. Okay, they're able to kick their legs and raise their head in prone. And usually that's going to be towards the 2 to 3 month period that we're seeing that. And remember, if you look on this picture, usually you might get questions that say, what are some play toys that would be appropriate for this child? Remember, 2 to 3 month mark, we're looking at things that they can look at, okay, that are sort of moving. So those mobiles, like those little mobiles that you can, kind of hang off of their crib and things like that, those are really helpful. A little bit of stimulation, toys that are more appropriate for your kind of 2 to 3 month old are going to be anything where they can shake him, okay? They can, like rattles and things like that can be super helpful. So those would be things that you'd be looking at, bouncers, tummy time mats that they can lay on, small musical toys, something that provides a little bit of stimulation, things like that, that would be appropriate for this age group. Okay, now we move on to the 4 to 5 month mark. Okay, remember in 4 to 5 months, by this time, they should really not have a lot of head lag. They should be able to sort of have control over their head and be able to hold their head up to some extent, okay? At 5 months, this is really the big main one. They're now able to roll from front to back, okay? So front to back, they're able to do that from prone to supine. Again, you don't need to sit there and memorize every single specific time. Just know that this is usually the 4 to 5 month period is when that rolling is starting to happen. Remember, everything that they're doing at this point is building up to be able to hold their body up so they can start walking. Okay, this is all a step-by-step procedure. So now they're able to roll from front to back, because remember, when you get up and walk, you just get up and walk all of a sudden? No, you have to roll, you have to sit up, you have to make sure you have control over your head, and then you stand up. So sort of like that. So remember, they're able to grab objects voluntarily, and those motor reflexes, those startle reflexes are going away. Okay, they can mimic sounds, they can change their crying tone to whatever they want. And I remember there was this video that I watched a long time ago about this woman who was talking about what the sounds that the infant makes, what that means, right? If you listen very closely. And it's not all, they're not just making random sounds. Those are because their needs need to be met. That's how they are communicating. And they're usually able to copy the expression of the caregiver. So if you make like big wide eyes, they're able to match that. If you, make a happy face, they're able to match that. So they're able to copy the expression of those caregivers at 4 to 5. The biggest thing biggest takeaway from here is that they're able to roll from front to back. That is the biggest key takeaway that we have here. Okay. And next one, at 6 to 8 months, remember, birth weight is going to double at 6 months. Okay, that's a big milestone. So whatever weight, maybe they were 5 pounds at birth, now they're 10 pounds. Excuse me. At 6 to 9 months, they're able to they should have already established this. So even though this is on here, really by that 6 to 9 month period, they should be able to roll from front to back, from back to front. They should be able to do that. They should go the full circle. Okay. At 6 months, they're able to hold a bottle. So if you give them a hold, they're able to sort of grasp it and hold it. And at 7 months, they're able to even transfer objects. So if you give them one object, they're able to what we call cross midline, the center of your body, and they're able to cross over and do things like that. Okay, transfer object from one hand to another, all of these things. Remember, they can sort of babble mama, dada, and they're able to respond to some names. Okay, they identify faces. They know that lady is their mom and that man might be their father. Okay, so start solid foods at 6 months. Okay, we're going to get into a little bit more detail about foods. I feel like that's a slide on its own because there's a lot of food restrictions on in terms of what they can have, what they can't have, all these different things. Remember, now this is not really, this can vary by culture, but per NCLEX, per US food regulations and things like that, honey is not recommended to be given before age 1 due to the increased risk of botulinum toxicity. So if you remember what botulinum was, this is really a bacteria, and it's going to produce a toxin called botulinum. It sort of is known as Clostridium botulinum is the name of the bacteria, and it can sort of cause toxicity, okay, things like that. And remember, object permanence also starts developing, where they can see something, but it exists. So they cannot. So the understanding is that with object permanence is that you are having the understanding that just because you can't see it doesn't mean it doesn't exist. So for example, say you do peekaboo, right, with this age group, right? So you are peeking and then they don't see your face anymore. That doesn't mean that you don't exist. You're still there. So by this time, they have that understanding that just because you're gone from their visual presentation doesn't mean that you're not there. So, I've seen these, images of where like the caregiver will hide behind a sheet. And then once the, kind of the sheet is gone, the baby might still come and look for you because they know you're behind the sheet. So that's object permanence. Very important to understand that. I've seen some test questions, maybe not at NCLEX as much, but probably definitely on ATI and HESI. I've seen some test questions there as well. Okay. At 9 months, they're really able to sit without support. So even at the 6 month category, they still need a little bit of support to be able to sit up. And at 9 months, though, they are fully sitting without any support. And they can usually actually even lift their arms up to get picked up, as in, pick me up. Okay. Peekaboo would be an appropriate age game to play with this age group. They really get a kick out of it with peekaboo. Okay, 7 to 10 months. Again, these are generic ranges. Just know that usually by 10 months, like I would always remember, and what is the maximum amount of time that they have to establish the milestone is really 10 months. By 10 months, they should be starting to crawl. If they're not, then again, a month or two delay is not concerning. But if they're having more delays, like even after like the age of a year, they're not crawling, that's concerning at that point, right? So 7 to 10 months, just remember they should be crawling. Sometimes in some children, this may happen a little earlier. In some children, it may take some time, okay? All right, let's look at a test question. Hopefully you didn't see the answer there. Okay, so this is going to be a 12-month-old arrives at the health clinic, to the health clinic for a well visit. You're assessing the infant's developmental milestones. Select below all the milestones the child should be able to perform. A, rides a tricycle. B, draws a triangle. C, pulls to a standing position and can take a few steps. D, follows simple commands like wave, bye-bye. E, puts objects in a container. F, hits 2 small wooden blocks together and says 2 to 3 word sentences. Now, here is my recommendation, all right? If you are getting all that, select all that apply. I know I've gone through this with a lot of my students that are, doing tutoring with me, that you definitely don't want to overwhelm yourself and you're like, oh my God, I don't remember what the heck, all these things, what milestones, when, what, I don't remember any of this, okay? Okay, don't worry, okay? All you're going to do is you're going to look at what month is a child, do they have anything else going on with them? Okay, and what should they be able to do? So 12-month, just think at 12-month. I know we didn't specifically talk about the 12-month milestone yet, but by 12 months, the goal of a 1-year-old, okay, is to be able to stand up and take a few steps. Okay, either holding on to furniture or holding on to somebody. That is the basic minimum requirement that we are expecting of our 12-month-old. So if the basic minimum requirement I'm expecting of a 12-month-old is to be able to sort of walk with some support or maybe even unassisted, what can you expect them to do? Can you expect them to ride a tricycle by 12 months? Absolutely not, okay? They're just starting to walk. How can they ride a tricycle if they're just starting to walk? It's almost like, how can you ride a bicycle if you're not able to walk? Okay, draw a triangle. A 12-month-old does not have the fine motor coordination or the hand dexterity to be able to draw a triangle. So we are going to say probably not. Remember, 12-month-old is going to have more what we call gross motor strength. Gross motor is going to be where you don't have what they call the hand coordination to be able to do those minute things. So that takes some time to develop in children as well. So we don't really usually see this by the 12-month period, right? We usually see that more so in your 2 to 3-year-olds that you were seeing there, but really by 3, they're able to copy, and then they're able to then by 4 or 5, they're able to sort of independently draw that triangle. But yeah, that's a little too advanced for 12-month-old. If the 12-month-old is already doing that, I would consider them to be a child prodigy, right? Probably very high up there in terms of intelligence and things like that. Now, you can train people to do it, but again, a 12-month-old is not going to have the capacity, the mental capacity to be able to, an average 12-month-old is not going to be able to have mental capacity or the attention or the focus and all those skills required to be able to do that activity. So B is not the correct answer. C, pulls to a standing position and can take a few steps. Yes, C is correct, right? This is appropriate for a 12-month-old. This is exactly what we want them to do. We want them to hold on to furniture and be able to take those first few steps. Okay, D, follows simple commands like wave, bye-bye. So think about any 1-year-olds that you know, right? They're able to follow simple commands, right? They're able to say, tell mama bye-bye. They're able to do that. They're able to follow those very, very basic, simple commands. Okay. E, puts objects in a container. So if you've ever seen those big blocks these kids play with, and they have them in like this large container, these kids can pick up big blocks. Okay, they can pick big blocks, big stuffed animals, big toy trucks, not like very heavy, but maybe like those kind of lightweight trucks. They're able to sort of move that, okay, and put it into a container. Hits 2 small wooden blocks together. Yes, they can do that. They can do bam, bam, okay? They can go ahead and kind of put those 2 blocks together, and that's something they're able to do. Okay, so they're definitely not going to be able to say 2 to 3 word sentences. We see very basic vocabulary at this point. We see things like mama, dada, those very, very basic things. More cooing, especially in the earlier stages of development. It's more cooing that we're seeing, not really 2 to 3 word sentences. So the correct answer is going to be C, D, E, and F. Okay. And again, you have to go through these things and say, what is expected of a 12-month-old? Okay, what is expected of a 1-year-old? What is expected of a 2-year-old? What is expected of a 3-year-old? And usually we only really go up to the 5-year category, because after that, usually most children, the milestones are sort of already met. Now, the extra stuff that does happen, their ability to pick up things like that, that's all basically, it's not really it's not like the basic requirements. The milestones are basically what we have, basic requirements that all human beings should have at one point or another. Okay, here is your patient is 6 months old. Which developmental milestone, if not performed by the patient, should be further investigated? Ooh, okay, so at 6 months, what if they're not doing this? That is cause for investigation. What do you think this could be? Okay, your patient is 6 months old. Which developmental milestone, if not performed by the patient, should be further evaluated? Okay, now I'm going to give you guys a second so you're able to sort of look at this answer, because I know I sort of went over the other answer for you guys. So if they don't do this, why is it concerning? They don't do what? And I'm going to give it another minute. Okay, and the answer is B, rolling over from stomach to back. Remember, by 6 months, they should be able to do all that, from going from supine to prone, so from back to stomach, and from stomach to back, they should be able to do that by 6 months. Okay, and usually we're going to start crawling a little bit after that. So once they're able to roll from front to back to front, they're now at the crawling stage, the 7 to 10 month stage. Okay, sitting without support. So at 6 months, are we expecting them to sit without support, or is that a skill that's a little bit more advanced? I would say it's a little bit more advanced, sitting without support, because if they're sitting without support, usually that means that it's usually between the 7 to 8 month period. And usually if they are doing that, that means that they need to have good head control, which they should already have, and they should be able to have good trunk control, meaning they're able to hold their body up. So usually about 7 to 9 months is when we start them having sitting without support happening. Right, next question, or next developmental milestone. So at 7 months, remember, we are now seeing what we call fine motor things coming on. So this is fine motor alert here. So you're seeing more fine motor things coming on here. So here we can see that they develop what they call the pincer grasp. Remember, the pincer grasp is when they're able to, I always think about it as a pinch, like you're pinching something, okay? This is your child that is picking up these, I wouldn't even go as small as Cheerios, but I would say at least blocks, okay? That they're sort of picking up these bigger things with this pincer grasp, which is usually using their thumb and their pointer finger. That's a pincer grasp, your pointy grasp, okay? Your index finger and your thumb, you are using that to pick up objects. That is your pincer grasp, should have this. This is part of fine motor, okay? Fine motor coordination we're going to see. Now here is at 12 months, all the things that they should be able to do at 10 months, or 12 months, excuse me. So they're able to pull themselves up to stand, walk, holding onto furniture. Okay, so they're able to walk, holding onto furniture, or holding assistance with an adult, like you see in this picture. And some children can even start walking independently for a couple of steps as well. But usually the basic minimum requirement that we have is that they're able to put themselves to stands and maybe take a few steps with the assistance of an adult present there to give them support. They are able to pick up things between their thumb and their index finger. The pincer grasp was there, able to drink from a sippy cup, and they can be started on whole milk. Usually at the 1 year mark is when we can start them on whole cow's milk, not prior to that, okay? Pulls to a standing position and can take a few steps, and they're able to follow simple commands like wave bye-bye. They're able to put objects in a container, and they're able to hit 2 small wooden blocks together. This is now the 15-month mark, and we're going to go up to the 18-month mark, and we're going to then switch over to doing some conditions about what should be happening before we move on to the bigger years as well. So if at 15 months, so really by 15 months, they should be able to take a few steps on their own. Like I said, at 15 months is when they're able to independently sort of take steps on their own. They're walking. They're able to stack 2 blocks and some more on their own. So they're able to pick up 2 big blocks. They're able to stack it. And this is where we also start seeing them having a lot more finger foods and things like that at this age point. Okay. At 18 months, so 18 months, remember, generally is 1 year and 6 months. They're able to walk without holding on to anybody or anything. They are independent. If by 18 months they are not walking, this is concerning. They're able to drink without a lid. They have to try to use a spoon to feed themselves as well. Remember, toys around this age group is push and pull toys. So if you've ever gifted presents to a family who has kids, right? I always, usually think, well, if it's a child, it's a newborn, right? Most times we have those newborn birthday parties or baptisms and things like that you're going to go to. Usually you're thinking, what kind of toys would be appropriate for this age group, right? I mean, a lot of people just like to, think about, I'll just get clothes or something like that, super easy. But if you're giving them a toy, you want to think, hey, is this appropriate for the child? Is this too basic, or is this going to be age appropriate for them? Or can maybe if you give them a toy, maybe they can use it still in a couple of months. So what would be appropriate for that? So push-pull toys are really good around this age because that will sort of help to give them a little bit more support as they're walking. So I've seen these, these toys where it's almost like a little, like a little lawnmower thing that they can push around. I think that's a great toy to give, sort of to kind of push and pull and then kind of get them going on their own, to sort of not be able to hold on to an adult, sort of get them, going on their own and things like that. So able to walk without holding on to anybody or anything. Drinking without a lid can be done independently. So there may be some spillage, of course, but they're able to do that and try to use a spoon to feed themselves. Like I said, they already have the pincer grasp. Now they're going to have more of a palmar grasp. So they're able to kind of just pick up a spoon. They might not hold it the way that you normally hold it. They sort of hold it like this, and they're able to scoop up some food and bring it to their mouth. Okay, that is the 18-month period. So really, just a brief overview here, at 12 months, remember, they are able to do these things by themselves, or they're able to, at least basic minimum requirement is that they are able to get up and start taking a couple of steps by 12 months, and that they are able to transfer objects between their hands in terms of fine motor, and by 18 months, honestly, they should be walking without holding on to anybody or anything. Okay, drinking without a lid, and they're trying to use a spoon to feed themselves. Again, by 18 months, we want to see them walking by themselves. Right. Okay, we're going to come to a pause right here, and then I'm going to switch on over, and we're going to talk about fontanelles and different things about what those mean. And those would be some things that I would say, I would emphasize that you kind of spend your time on as well. Definitely knowing the developmental milestones is great, but don't sit there and try to memorize every single thing, because that's not going to happen. Okay, and it's not really beneficial for your learning to sit there and memorize every single thing. Like I said, you want to look at big picture items, big picture things that are going to be tested, and not too much into detail. You just generally want to know what's happening in that area or around that time period. Okay, I'm going to go ahead and come to a pause right here.